Hi, I'm Nurse Barb, and this is your daily dose on the COVID vaccine and boosters. So recently, the Centers for Disease Control and the FDA approved people getting booster shots to protect them against the COVID virus. And we've learned a lot about this virus, how vaccines work, and what's the best way for all of us to stay safe. So when it comes to COVID vaccines, if you've already had either 2 of the Moderna or 2 of the Pfizer or 1 of the Johnson & Johnson, you may be eligible to get a booster vaccine. I know a lot of you have already taken advantage of this, but there are some people who still have some questions, so maybe I can break it down for you. When it comes to the COVID boosters, what we know is that people naturally start to develop a little bit less immunity over time. So the reason that it's being recommended that people get a booster is that we're following people's natural antibody response. And after about 6 months for both Pfizer and Moderna, people's immunity is starting to wane. Now, when we give the COVID vaccine through Johnson & Johnson, we see that after about 2 months, that immunity is starting to decrease. And that's why it's recommended that if you've had the Pfizer or the Moderna vaccines, you should wait 6 months after your last one to see if you're eligible for a booster. And if you've had Johnson & Johnson, you can wait 2 months to get a booster. So we know that it's very normal and very natural for immunity to decrease after any vaccine. Think about your tetanus shot, right? You have to get that about every 10 years because immunity does tend to decrease over time. So this is not unusual, and this is completely expected. Now, I looked at the data on using the boosters, and I looked at it for Johnson & Johnson, Pfizer, and Moderna. And what I'm going to tell you is what all of us are seeing with the data. It really doesn't matter which vaccine booster you get. It doesn't matter which one you had first and which one you decide to get next, because all of them increase immunity to about the same rate and help protect you. And these vaccines were designed to protect us against getting what's called serious COVID, meaning we would be so sick that we'd have to go into the hospital, maybe use oxygen, and it helps protect against those serious cases that can lead to long-term COVID infections, or the ones where people are still suffering with a lot of other issues like loss of memory or chronic fatigue. So when it comes to the boosters, who needs it? Well, anyone over the age of 65 is eligible for a booster if they've already had their vaccines. If someone is under 65 and they have a serious health condition that puts them at higher risk, that is someone with high blood pressure or diabetes or heart disease, and they're under 65, they also qualify. But for anyone who's 18 years or older, who lives or works in a high-risk situation, they are also eligible for a free booster. Now, all of these boosters are free, but for people over 18, that might be someone who works in food service because they're coming into contact with a lot of the public. It also means someone like myself. I'm 63, I'm a healthcare provider. I see a lot of patients in my practice, and some have not been vaccinated, some have, but there can be breakthrough infections. It also means my friend who's a teacher, right? She's being exposed to a lot of children in the school, and the firemen, the postal workers, the people who deliver packages. If you have any questions about whether or not you're eligible to receive a booster of the COVID vaccine, you can check out the CDC website. When you go to get the booster, keep in mind that it's really meant to improve your immunity. And so if you had a reaction to the last vaccine that you received, you may have another one, or it may be, you may have a little bit more symptoms. Of course, anytime we get any kind of shot or injection, we can get some pain or soreness at the site. So be prepared for that. You may also experience a headache or some joint or muscle aches. You may get a fever or chills. All of these are really good signs that your immune system is ramping up and strengthening to protect you against having a serious infection with the COVID virus. I know that there's a lot of controversy out there, but you can always go to my blog, nursebarb.com, for more evidence-based information. And if you found this video helpful, please click on like and subscribe for more. And I hope that you stay well and stay safe. Don't wait to get the booster because it's just getting colder. More people are going to be gathering indoors for the holidays, and that means there can be more risk of transmission and spread. Take care and be well.